One of my all-time favorite clinical experiences was working in an ambulatory care clinic at Grady Health System in Atlanta, Georgia. And the reason for that is because we put organizational health literacy into practice every single day with every single patient we saw in that pharmacist-led clinic. Before we get too deep into this story, I'm Megan Freeland. I'm a public health pharmacist by training, but my work is really to enable patient advocacy through strategic communications and health literacy. And thanks for listening to the Health Literacy in Real Life podcast. Now, at this pharmacist led ambulatory care clinic, we saw patients who had been newly diagnosed with diabetes, high blood pressure, high cholesterol, etc. And every day I would get to work with these patients and help them understand their newly diagnosed condition and how to best manage it, how to work with their care team to manage their condition at home. For many of the diabetes patients in particular, a lot of them had progressed so much into the disease, even though they were newly diagnosed, that they immediately required insulin therapy. That can be a tremendous mental hurdle to overcome. It was for a lot of them who associated insulin treatment with their elders and who really had a hard time mentally reconciling the fact that they would now be on insulin therapy as well. But it was also a practical and technical learning curve that they had to master. Self-injecting insulin, whether it's with a vial and a needle or with an insulin pen, is not easy. And so I would get to spend about an hour with patients to train them on how to self-inject insulin, how to check their blood sugar at home, etc. The story of this clinic actually helps exemplify the difference between personal health literacy and organizational health literacy really well. If I am the newly diagnosed patient and I'm learning more about diabetes, what it is, what it means, how to manage it at home, I am improving my own personal health literacy with that information. The fact that the ambulatory care clinic exists, the fact that there are pharmacists who are assigned to this clinic to help these patients, the fact that we have processes and procedures and protocols that we implement with each patient to help ensure that we're recommending the right therapies to their prescribers, that we are teaching them how to use those therapies. That is organizational health literacy in action. So, to step back a little bit and provide a more formalized definition, personal health literacy is an individual's ability to find, understand, and use health information and health services. The organizational health literacy is when the organization enables the individual to do that. Now, that was an example from my personal experience, but there are several other examples of how organizational health literacy can be applied in different types of healthcare settings. So let's talk through a few of those examples. First, we'll start with examples for hospitals and health systems. Now, we know that there are a lot of things going on in the hospital at all times, and transitions of care. So when a patient is moving from one setting within the health system to another setting, or they're transitioning out of the health system, such as at discharge, that is a transition where there's a lot going on and it's easy for patients to get kind of lost in that shuffle. And applying organizational health literacy principles to the hospital discharge process could look like auditing and improving the materials that a patient receives before they leave the hospital. How long are these packets? How easy are these packets for them to read? Are there visuals incorporated? Are there charts and tables so that patients can better understand the information being delivered? How can we improve and optimize this hospital discharge packet itself? Also, beyond the packet, are we supporting patients with one-on-one support, perhaps from a pharmacist who can come into the room before the patient is discharged and explain any of their treatments or medications they've been prescribed to make sure that they are not doubling up on medications, that they're not continuing a medication that they came into the hospital with when really their medication has been changed and they should be starting a new one, to understand what types of side effects they should look out for and when they should call their provider if they're experiencing complications or potential side effects, etc. So the organizational health literacy initiative is, how do we as the organization, as the institution, help improve this particular process for the patient? And those are some examples of ways that it could be done at a hospital or health system. In a biotech company or a pharmaceutical company, sometimes organizational health literacy looks like creating digital tools so that patients can improve their digital health literacy. So, for example, perhaps you are creating a website or a community forum, a microsite, some type of digital space for patients who are experiencing a particular condition. And maybe there are informational resources on that site, like easy to understand explanations of the disease. Perhaps there are interviews with providers who are answering frequently asked questions about that disease. Maybe there are real life stories from patients who have had that condition themselves or who have taken the medication themselves. But housing all of this on a very user friendly site, the organizational health literacy is how do we analyze the usability of this website and improve it if there's room for improvement. So, organizational health literacy isn't always about doing something new. Sometimes it's about optimizing what already exists, evaluating how it's performing, and optimizing as needed. For payers, financial health literacy is huge. It is very difficult for many patients to navigate the insurance system and to know what types of support they have. So, a very simple way for payers to enact organizational health literacy principles is through a know your benefits explainer, for example. So, maybe this is a 1 or 2 pager that is an easy to understand breakdown of benefits. Perhaps this is something that's provided in a variety of formats, like in a video as well for the visual learners, a resource to help patients be able to improve their own financial health literacy. And then for direct primary care models, where the membership comes with several benefits, but where a lot of patients don't necessarily take advantage of all of those benefits, possibly because they are not sure what all of those benefits are. One example of an organizational health literacy approach in this case is to ensure that all new DPC members receive some type of resource explaining how to use your membership, like a how to use your membership guide, whether that's again a 1 or 2 page document, an infographic, a video explainer, a short email series. The formats can vary, but the point is an explanation that is easy to understand of how to get the most out of your membership. Because again, by doing that, you're enabling the patient to better find, understand, and apply the information and the services that they have access to through the membership. So hopefully these examples paint a picture of how organizational health literacy can be approached and applied, and also drive home the point that organizational health literacy is everywhere. All health organizations can be a part of advancing organizational health literacy, which thereby improves personal health literacy. And as for why it matters, this is beneficial for all parties involved. So for patients, they get more clear on their care. They are more confident, they are less confused, they are able to feel and get better and be well because they are better supported through the healthcare, the public health system. For organizations, it helps them build better trust with their patients, whether it's directly through the provider and patient relationship or whether it's with the organization at large. The provider being a representative of that organization, when that trust is built and that trust is strengthened, that extends to the organization as well. They're also able to avoid unnecessary costs and to see better outcomes. And then for the health system at large, health literacy is really one of the key ways that we operationalize health equity. So as we start to see better outcomes, especially when organizational health literacy initiatives are targeted to specific segments, and that's not to say that some populations need organizational health literacy support and others don't, because statistics show that nearly 9 out of 10 Americans struggle with low health literacy. So that means almost everyone needs some type of support in some way. The trick is figuring out what populations need what type of support and then targeting and tailoring that support to those populations. So at the organization level, when you're able to do that, you see better outcomes across the board, and it's really a pathway to better patient safety, better patient experience, and ultimately to health equity. So I shared several examples with you here, but if you have examples from your institutions, examples of organizational health literacy in real life, in practice, I would love to have you as a guest on the Health Literacy in Real Life podcast. You can, of course, subscribe to the Health Literacy in Real Life podcast, but if you or someone you know would make a great guest and would be willing to share some of these incredible examples of health literacy in real life, I would encourage you to complete the guest recommendation form. That is always either linked at the bottom of the video if you're watching on YouTube, or in the show notes if you are listening on a podcast app. I'll see you in the next episode.